Sitting down the table at the next cabinet meeting from Emile Bove will be Robert F. Kennedy Jr. He was sworn in as Donald Trump's Secretary of Health and Human Services after a career and global infamy, really, of attacking vaccines and other health measures. He now leads America's public health infrastructure, which is already under assault by the Trump administration. All but one Republican senator voted for him to confirm him, and that was Senator Mitch McConnell, who survived childhood polio. In a statement, Mitch McConnell said he refuses to condone the relitigation of proven cures. Several of his Republican colleagues expressed that same concern, but still voted to confirm Robert Kennedy today. This followed 2 days of confirmation hearings that proved to anyone watching that Kennedy is unprepared to answer some basic questions about science and the responsibilities of the job. Joining us, former White House COVID-19 response coordinator under President Biden and the dean of Brown University School of Public Health, Dr. Ashish Jha is here, plus former Obama White House policy director and MSNBC medical contributor, Dr. Kavita Patel is here. Dr. Jha, there are all the reasons that he was dangerous to health that Mitch McConnell articulates around vaccines, especially the polio vaccine. And there was the indictment of his character from a family member, something I've never seen in my entire career. His cousin Caroline called him a predator and blamed him for leading other family members toward the path of addiction. How did this happen?
So, Nicole, first of all, thanks for having me back. I mean, I think the reality is, as many of us have been saying for a long time, Robert F. Kennedy is wildly unqualified for this job. And now that he is in the job, we will have to hold him accountable because he is going to oversee the infrastructure that is necessary for protecting the health of the American people. This is not just about vaccines for kids. It's about Medicare for the elderly, a program he seems to know nothing about. It's a whole host of things that we rely on. And unfortunately, this is a man who has proven to date that he is unpersuadable by science, evidence, and data. Obviously, we're all going to hope that that changes.
What does that even look like?
Well, Nicole, it's a very good question. I mean, in the hearings, he said, hey, look, if I see any data that vaccines are safe, I'll be open-minded about it. Like, what data is he looking for? There is just so much data out there that he has continued to ignore. Nothing about his hearings gave me any confidence that this is somebody who's going to change his behavior after 30 years of casting doubt on proven cures, as Senator McConnell said. I think the consequences here could be quite catastrophic. And we will all have to speak up and push back and work with reasonable members of Congress across the political spectrum to make sure that he's held accountable if his policies lead to real harm to children.
I mean, we're going to have to go back to relying on folks like yourself. And so I hope you will answer our calls to be here. I'm sorry for the delay. As Chris Hayes sort of pulled back the curtain on our process, we were delayed in having this conversation because of breaking news, but we appreciate you talking to us, Dr. Jha. Dr. Patel, we, I think, have sat through the slow motion car wreck that is the right, sort of casting aspersions on known knowns when it comes to science and data and specifically vaccines. The tragedy is that if your kid is sick or your parent is sick, it doesn't matter where you get your news, and it doesn't matter who you voted for. You just want them to be healthy and well again. What are your concerns, sort of beyond any of the fractured politics, about people's ability to trust their doctors and trust the science?
Well, it's one of those abilities is being undermined right now. We're in the midst of one of the worst kind of flu epidemics I've ever seen. And there's a lot of questions about why it's happening, including some under-vaccination in parts of the country, Nicole. But we've got deaths that are following. It's affecting everyone. I bet everybody watching this knows at least one or two, or even themselves, people that have been diagnosed with the flu. But as clinicians, we're flying blind a little bit because we can't really trust that the sources from the CDC, especially when they're being told not to give us information, that we can't really trust what's coming even out of the government right now, because sometimes, some weeks, for 2 weeks in January, there was no information coming out of the government. So that translates to real lack of clarity, real lack of trust. And unfortunately, that translates to lives being lost. So it's happening right now. And I feel for the staff. I mean, I can't tell you how many career staff have been calling and trying to understand what's going to happen to them. These are the same staff putting together our flu surveillance protocols. They're the ones that put the data up. and they're worried that they're on some list or they have already been put on a list because of some sort of watchdog. So it's happening right now. And I think that, unfortunately, Nicole, this isn't just a this administration problem. If you take down this infrastructure or you put an undermined trust in the very thing that it didn't matter what politics we have as doctors that we depend on, then we've undermined several generations.